Here's why I would never choose a Medicare Advantage plan. I'm Elliot Apple, founder and financial planner of Kindness Financial Planning, and today we're going to be talking about the difference between original Medicare and Medicare Advantage plans. And it's important for you to know that I don't sell either of these types of policies. I am a financial planner, and when we're talking about this, we're going to talk about this through a financial planning lens, as well as the flexibility that they provide. So keep that in mind as you're listening here. Let's talk about what original Medicare is. Once you turn 65, you have the option to get health insurance through the government, and this is for Part A and Part B. But what's often missing with original Medicare, there are gaps, usually a co-insurance amount that you're responsible for. So many people choose to buy a supplemental policy or a Medigap policy to help plug some of those holes that original Medicare have. It'll help cover things like the co-insurance. Some are very generous in that you might pay a very, very small deductible for the year, and the Medigap plan or supplemental plan might pay the rest of it. So that is one option that with Medicare is you can stay on original Medicare, you can add that supplemental plan, and then also add on Part D, which is prescription drug coverage for better coverage overall. Now you can contrast that to a Medicare Advantage plan, which you can think of as sort of a one-stop shop. It's going to include typically things like prescription drug coverage, as well as some extras such as dental insurance. And so you're buying this one plan and it is covering most different types of your health insurance. Now, the issue that I have with Medicare Advantage plans, we're going to get into this a little bit more and compare and contrast them with costs, with flexibility, with what they provide. But the big thing that I don't like about Medicare Advantage plans is you're taking something that the government has provided and has specific and clear rules for and handing that over to a private insurance company. It doesn't take long to go through forums, to read online news articles, and see why that might be a bad idea. With Medicare Advantage plans, you have things such as pre-authorizations that you need to get. You're turning over to literally to a managed care plan. You're taking it out of the hands of the government that have said, hey, if original Medicare is willing to pay for it, your Medigap or your supplemental plan will also pay for it. So with original Medicare, when you add that, they're going to submit the bill. Original Medicare is going to pay what they're supposed to pay. Pass that to a supplemental plan, they're going to pay that. If you contrast that to Medicare Advantage plans, sometimes you'll need to get pre-authorization. You might need to get a referral from your primary care physician to go see a specialist. And even then, oftentimes claims are denied. We'll go a little bit more into that into detail, but that's important to know that you're giving up some of this flexibility. What's interesting about Medicare Advantage plans is that the government's essentially contracting with private insurance companies. So the federal government's agreeing to pay a private company to have some of their members. Now, a few years ago, this was about $1,000 a month. This has probably gone up since then. But basically, the Medicare Advantage plan, let's say they receive $12,000 a year, just as an example, they're going to try to keep costs under control as much as possible because they are aiming to turn a profit. They are a private corporation. Now, this isn't going to be for every individual that is on a health plan. Some people are not going to have any care throughout the year, and maybe the insurance company is going to pay out nothing, and all of that's pure profit. There's going to be other folks that have cancer where the insurance company pays out a lot. I know in the last few years of my dad's life, insurance companies paid a boatload of money out. So we're talking tens of thousands or hundreds of thousands of dollars per year for my dad's care because he was eligible for that. And he was on a Medicare Advantage plan. It's not something, again, that I would normally recommend for myself. It can fit in certain circumstances for people, but again, it's not something that I would personally choose. One of the crucial things to also keep in mind about the difference between these plans is it's not easy to switch from Medicare Advantage to original Medicare in most states. So if you turn 65 and you say, hey, I want a really low cost plan with a Medicare Advantage plan, because that is one advantage, is typically they can be no premium or very low premium, less than $50 a month often. If you go the Medicare Advantage plan route, and then let's say you're healthy for a long time and that plan works out for you, and then at some point you get cancer, you're diagnosed with a special condition that's going to receive more care, and you're getting a lot of denials from the insurance company, it's not as easy as open enrollments here, and you switch over to original Medicare. Oftentimes that there's underwriting, depending on the state, there's only a few states where this isn't required, but oftentimes you will need to go through an underwriting process. And obviously if you have cancer or some sort of condition, they don't have to accept you back. So you may be stuck on that Medicare Advantage plan for life. And that's really something to keep in mind, that this plan may work well for a really long period of time when you don't need care, but then when you need it most, it may not work quite as well as you anticipated. Let's talk about the costs of each of these. So with original Medicare and the Medicare Advantage plan, you're going to pay your Part B premium either way. And these premiums are based on your income from the last 2 years. So that's something to keep in mind, that if you have more income, your Part B and your Part D may go up in cost. Now, that is a temporary increase just for that year, but it is something to know that you're going to pay that under both plans. So that's sort of a fixed cost for both. Now, with original Medicare, as I mentioned earlier, oftentimes people are going to add that Medigap or that supplemental policy. The cost is going to be dependent on your age. It's going to be depending on where you are, what plans are available. Let's say that somewhere between $100 and $300, depending on a lot of different factors that go in there. You can go online, plug in your details, and see what the actual cost would be. All in, it may be a few $100s a month for original Medicare, and that is a downside to original Medicare, is if you're trying to help cover all these different costs and have more certainty around what you'll pay, you may be paying quite a bit per month. So this isn't affordable for everybody, but in situations where you can afford it, that is the route that I would personally go myself. Again, this is not advice for you. I'm talking for myself only. I'm not age 65, so I don't qualify for that, but that is the route that I would go. Now, we can compare this to a Medicare Advantage plan, which there are many Medicare Advantage plans out there that are $0 or no premium out of pocket per month. And you may be thinking, well, why wouldn't I go for that? Save myself a few $100s a month. Again, it's about flexibility. So with a Medicare Advantage plan, oftentimes you'll pay very little, under $50 a month, maybe even as low as $0. And that's gonna maybe include some prescription drug coverage. It might include some vision or dental insurance as well. Whereas on the original Medicare side, it's not gonna cover that. It's really meant to cover a specific scope of services. Now, with Medicare Advantage, keep in mind that you're going to have copays and coinsurance. So when we talk about, let's say, paying nothing out of pocket, that's just if you never use it. But if you were to go and actually use these services and you go see your PCP or a specialist, you may have a certain copay, maybe $5 to $35, potentially more for that. And then if you receive services, there might be a coinsurance amount that you're responsible for. Now, many plans don't have a deductible like traditional health insurance if you're under age 65, but you still do have that coinsurance amount that you need to pay, and then a maximum out of pocket. And depending on if your Medicare Advantage plan is a PPO or preferred provider organization or an HMO, a health maintenance organization, you may have different costs associated with that. So to sum it up in terms of costs, original Medicare is likely going to be more expensive, but if you get a good supplemental policy, good Part D prescription coverage, oftentimes you know what you're going to pay monthly, and then there aren't going to be a lot of extra out-of-pocket costs. Whereas with a Medicare Advantage plan, you may not pay much on a monthly basis, but when you go to use those services, you may have a pretty high maximum out-of-pocket. This could be $5,000 or $6,000 per year potentially. You'll need to check that with the policy that you select and see, is that worthwhile? Now, the costs aren't the only thing to keep in mind, and this is where I start to lean very heavily for myself that I would want to be on original Medicare with a Medigap policy and Part D prescription drug coverage. And the reason for that is the flexibility. I want to know that if a provider accepts Medicare, that I'm going to be able to get all the services that I need. Now, most providers out there do. It's something like 99% or so of non-pediatric providers accept Medicare. So as long as your provider accepts Medicare, you're not going to have any trouble with billing. They're going to submit the bill. Medicare is going to pay that. It's going to go to the supplemental policy and they're going to pay it. That is in contrast to a Medicare Advantage plan where you might go see your provider. They need to submit approval for some sort of procedure and they may deny it. There's lots of news articles about Medicare Advantage plans denying coverage, and unfortunately a lot of people don't go appeal those. It's a very low rate, but for those that do appeal it, it's somewhere between 75 and 82% of those appeals get overturned. Now, that should tell you right there's something wrong with the system. There's a lot of pre-authorizations that are essentially being denied that should not be being denied if 75 to 82% of them are being overturned at that point. And again, the problem is a lot of people aren't going to, and it makes sense. If you're going for a health procedure, what are the odds that as you're trying to fight this, that you're going to appeal a decision? Something's likely wrong with you health-wise, and that's the last thing that's on your mind. And that is a major reason why I lean towards original Medicare if you can afford it with a Medigap policy. The other thing to keep in mind, maybe you're thinking, hey, I can appeal it, that's no problem. What happens if you need to wait days or weeks or months and you need to go through this process and fight it? What does that mean for your own health as you're going through this? You may not have the option health-wise to wait that long. That's my primary risk with this, that it may never happen to you, but what if it does? There's lots of articles out there of people having to wait for care and suffering consequences because of it. Now, in terms of networks, we talked about this briefly earlier, but it's important to know that with Original Medicare, if the provider accepts Medicare, you can go to that person. There's not a lot of extra hoops that you need to jump through other than what your specialist might say you need to do prior to scheduling an appointment. That's not the case with Medicare Advantage. Medicare Advantage, if you have an HMO or a health maintenance organization, you're going to have your certain network of doctors and you're going to have a primary care provider. And that primary care provider is going to be able to refer you to those specialists. You won't be able to go see them directly. And it's only if they think it's prudent for you to go see them. So there's almost this gatekeeping to get to where you need to go. Now, some people love their HMO organizations and it works really well for them. And if that's you, maybe that's okay with a Medicare Advantage plan. For me, I want the ability to go see who I want to go see. There are also preferred provider organizations or PPOs that have a larger network, and you have people that are in network or out of network, so you have a little more flexibility with who you decide to go see. But even in that, sometimes there's places that you can't go. Mayo came out and said, hey, for the most part, we're not seeing Medicare Advantage plans. The reason a provider like Mayo may decide not to work with a Medicare Advantage plan is because of all the back and forth with insurance. It's much simpler to work under the original Medicare. There's a lot less billing that goes back and forth, pre-authorizations, and a lot less wasted time within that. So for me, I want the flexibility to go see the doctors and be in the hospitals that I need to be, particularly in those cases where I'm diagnosed with something where maybe my local hospital doesn't have the expertise to deal with that in an effective way. I want to be able to go and try to go get the best care possible. And if I have a Medicare Advantage plan, they may not accept it, or my Medicare Advantage plan may say, hey, you can't go there. And so for me, that's a really big deal. Another thing to keep in mind is providers could be dropped from a plan mid-year. So you might have a certain provider that you like seeing, and then you're on this Medicare Advantage plan for the year, and then all of a sudden you can't actually go see the person that you want to see. There can be mid-year changes. The other thing to keep in mind is as you age, if you end up in a skilled nursing facility or some sort of rehabilitation center, Medicare Advantage may have more incentive to try to get you out sooner. They may be monitoring your progress and saying, hey, you've met the medical qualifications to leave and go back home or go to a different living facility, whereas Original Medicare might not be monitoring that as closely, or may actually just accept the doctors that say, hey, you need to be here. Medicare goes, okay, that's fine, they can stay there. Whereas with a Medicare Advantage plan, again, you have that monitoring from this private corporation that's trying to earn a profit. They're gonna say, hey, you've met our criteria for leaving. We're gonna kick you out now. It's Wednesday, you need to be out by Friday. And they have to scramble to get all that care. What does that mean? And I know that's hard if you're 65 or maybe you're not in a situation where you're in a skilled nursing facility, but imagine that you need all this extra care, you don't feel equipped to leave yet, and it is medically necessary because the staff is saying that, but the insurance company is saying you need to go. Another component to think about, particularly for people who live in different states or travel, Medicare Advantage plans tend to be done by zip code, and they tend to have networks that are close by to that zip code. So if you live in Washington State and you go down to Arizona for the winter because you want that sunshine, a Medicare Advantage plan may not work as well. You may have to be more selective in what types of providers you see or where you establish care. Now, with emergencies, Medicare Advantage plans are supposed to cover those as well. But do you really want to go through a situation where you're wondering, hey, is this an emergency or not? And you go in and maybe your visit's coded as a non-emergency, and now you're paying out of pocket for that. So that's the problem that I see with a lot of Medicare Advantage plans, is there can be more surprises down the way, whereas with Original Medicare, it's going to be covered assuming that they accept Medicare. Now, this should be a relatively minor thing, but agent incentives are important to know. Medicare Advantage plans for first-year commissions tend to pay more than Original Medicare. This varies by state, but typically Medicare Advantage plans will pay $626 a year for that first year commission. In most states, there are a few states where this is a little bit higher, and then the renewal is $313 per year. Now these are $2025. This should probably go up in the future. Medigap plans, in contrast, may pay 20 to 22% of the first year commission of whatever the premium amount is. So let's say you have a policy where you're paying $150 a month, and that's $1,800 a year. The agent may receive $360 a year. So with that, you can see Medicare Advantage plans pay almost twice the amount of Original Medicare. Now, I'm not saying every agent out there is trying to push Medicare Advantage plans because it offers a higher commission, but there are incentives for that, and that is important to keep in mind. Now, when it comes to renewals are about half the value, both for Medicare Advantage and for Original Medicare that I previously talked about. Part D also has a commission, so if you're on Original Medicare and you go do that, That's $109 for the first year and then less in future years. As I was researching for this video, I found some interesting stats of just how big this market is and how concentrated it is, particularly for Medicare Advantage. Medicare Advantage enrollment has gone up a lot. If you look at the chart from where it was in, say, early 2000s to now, about 54% of Medicare eligible enrollees are going to Medicare Advantage plans. So advertising is working and people are going out to do this, but I have a lot of hesitation, a lot of caution, given research that's been done about how many people are being denied coverage that they otherwise probably should be receiving, and how much more expensive Medicare is for the government because of, we'll call it, extra diagnoses. Now, whether the research is flawed or not, there's different perspectives on this, but it does seem like an insurance company has an incentive to essentially diagnose people with more so they can receive higher payments. So that's important to keep in mind. There's articles about where doctors are receiving checklists before they even see a patient of things that they could be diagnosed with. Now, someone might say, hey, this is good medicine, or thinking about ahead of time, but I think if you meet with a lot of doctors, they would say, hey, let's go meet the patient, examine them first, see what's going on, and then diagnose them. So just keep that in mind that as you're thinking about Medicare Advantage plans, are the incentives aligned in a way that I feel comfortable being on this plan, and how does it work in my budget? It's also a very big market. It's estimated that the federal government's going to pay Medicare Advantage plans, or the health insurance companies, $500 to $600 billion, that's billion with a B, dollars in 2025. The last thing I'll say, that enrollment is very concentrated in a few companies. For example, United Healthcare and Humana account for about 47% of Medicare Advantage enrollees. So that is almost half are going into two corporations. And even if you then go down the list, the next few have a pretty large share of that as well. So for me, that's just concerning because there are very few companies controlling the experience, and I don't want to say can do whatever they want because there's still the rules of Medicare that they need to follow. But again, if we're talking about pre-authorization, if we're talking about what's in network or out of network and what's available and trying to get people out of skilled nursing facilities, all to turn a profit, there are incentives there that aren't necessarily aligned with me as a policyholder that I have concerns about. I hope you have found this helpful as you're thinking about for yourself whether to go with original Medicare and add a Medigap or supplemental plan plus Part D, or if you're just trying to do the one-stop shop and do Medicare Advantage. There are pros and cons to both, I'll be honest about that, but I am pretty biased in that for myself, I would choose original Medicare. Again, this is not advice. This is something that I would choose for myself just because I value the flexibility and would be willing to pay extra to know that, hey, I pay this certain amount and I don't really have a lot of extra out-of-pocket costs, and I have the flexibility that, assuming that they accept Medicare, I'm going to be covered. I don't need to worry about emergencies or other things that are going on. I can get the care that I need. I find that a lot of the complaints about health insurance that people have under age 65, like pre-authorization, waiting times, unknown costs, all of those things are often included with Medicare Advantage plans. Whereas if people stayed on original Medicare, a lot of those concerns go away because there's more certainty within the program of what it provides and how it operates. Hope you found this helpful. If you did, comment down below. Are you on original Medicare? Are you on a Medicare Advantage plan? I'd love to hear how it is and how it's going. Thanks for watching.